The COVID-19 catastrophe has left a devastating mark on our aged care system, claiming the lives of nearly 700 residents. A Royal Commission special report has now found elements of the government's actions were insufficient for a sector traumatised by the disease.
These are some of the faces of Australia's 665 most vulnerable who lost their lives to COVID-19 in aged care. The Royal Commission examining the government's response has heard some heartbreaking evidence.
I know I'm here till I die, so every morning when I wake up I think, damn, I've woken up.
And in a special report to the Parliament, it says the COVID-19 pandemic has been the greatest challenge Australia's aged care sector has faced. Now is not the time for blame. There is too much at stake.
Every single mortality and death in aged care as a result of COVID-19 is an absolute tragedy.
The report has made 6 recommendations, including the most immediate, funding to ensure there's enough staff to cope with more visits between residents and their loved ones, and urgently making allied health and mental health services readily available, establishing an aged care plan and advisory body through the National Cabinet, and ensuring more infection control training and experts in every facility. The Commission found preparations by the federal government were in some respects insufficient. In response, the government has said it will adopt all 6 recommendations and has pledged more funding.
We think that they are quite constructive.
The report notes there was confusing and inconsistent messaging from providers, the states and the federal government, leaving carers, residents and their families asking who was in charge.
One of the difficulties that we have faced is the very different circumstances and the different approaches of each state. There are clear learnings out of this. We continue to act on those learnings.
Kerry Yaxley, 9 News.